if you've been watching social media, you've probably seen there's two disturbing cases that involve Black women that went into labor. One was in
Always a
Texas and
black
one
woman.
is in, I'm sorry. What'd you say?
It's always black women.
Yeah, there's two cases of Black women that went into labor. One lady was in Texas and Dallas, and another lady was in Indiana and ended up giving birth in Illinois or on her way to Illinois to have to give birth to a baby because the hospital put her out. Both were forced out of the hospitals they were giving birth. Just minutes later, they gave birth to their babies. So these are isolated incidents. As Aaron said, they reflect a nationwide maternal health crisis where Black women are still 2.5 to 3 times more likely to die from childbirth complications while in a hospital. And the bias of understaffing hospitals, not taking the complaints of women that are giving birth to children, really Black people in general, not taking their complaints seriously in the hospital, cost cutting in inner city hospitals, and all these other things have contributed to this. One is in a trauma unit in Houston, and then the other doctor and nurse are here in Indianapolis. And all three of them said every nurse and doctor involved in both of those cases need to be fired. Every last one of them. Because it doesn't matter if she's 3 centimeters dilated, in the case of the lady here in Indiana that eventually had her baby on the side of the road on the way to the next hospital. Her husband delivered their baby and an unsanitized car on the side of the road because some doctors and nurses did not take seriously that this woman was in labor. Y'all, there is systematic oppression and racism towards Black and brown people because Hispanic women are about 2 times more likely to die than white women. I think it's important, and I'm thank y'all for giving me this time, fellas. I know we way over time, but I really wanted to cover this because we have to hold this conversation. And anytime you are in a hospital and you feel like you are being mistreated in a hospital, we got to start getting our cell phones out and recording that just like we record the police. We're just now recording them. And I think that's a good note to remember. You have to advocate for yourself. And if you're in the hospital with a woman that's being, or anybody that's being mistreated, or you don't feel like they're getting effective care, advocate for that patient. Advocate for people who cannot advocate for themselves.